session. We are ready to start.
Добрый вечер, дорогие друзья.
Good evening, dear friends. We are very happy to see you here in the evening of the third day of the 18th Assembly Moscow Health. 18th Assembly Moscow Health is the biggest event in medicine of this year. So these numbers can support this claim. So over 30,000 press interviews with authorities and foreign experts, over 50 discussions and sessions, over 30 exhibitors of Moscow Healthcare Department, over 100 workshops, presentations and seminars, over 60 journalists visited the events of the Assembly, and over 15,000 materials were published in the media, and over 15,000 people visited the Assembly on the first day. Here you may give us a round of applause. The peculiarity of this 18th Assembly is that this event is organized not only for professional medical community, but also for large public who are not doctors. They can easily participate in the events of the Assembly. So all the participants are involved. All people who are interested. Before opening this sport medicine session, I'd like to start with this nice surprise. At this assembly, we're not only discussing important issues related to the medical care, but here we'll award the person as a result of the contest Festival of Formula of Life. For all the medical workers, it's an opportunity not only to share their professional experience and improve their qualification, but also to present to large public the image of a modern doctor. So each person who serve people as a doctor, they are real heroes, and now we'd like to give this award to one of such people. Specialist of the Year in the nomination, a physical therapist and sport medicine specialist. And so I'd like to bring here MD, moderator of the sessions, specialist of sport medicine, first deputy director of Moscow Scientific and Practical Center of Medical Rehabilitation, Rehabilitative and Sportive Medicine, Zurab Ordzhonikidze, to present this award. So please tell us a few words, dear colleagues. I'm happy to see you all here this evening. Good evening. I think that such amount of people that I see here today, there is not even enough seats for everyone. It's for the first time for the many years, and thank you that you came to listen to our reports. They'll be very interesting. And this award that I'm about to deliver. So you understand who won the award? It's not the first days and the first weeks that we've been talking about this person. So I'll give this award to Victoria Batiyeva. Won this award. You should give her a hand. So why Victoria Batiyeva can't be here? Because she represents Russian Federation, our country, our center, and Department of Healthcare in Qatar, where there is an international congress on sport medicine. And she has many awards. She's MD professor, a member of Russian Academy of Science, and now she got this award. So let's give her a hand again. I'll give this award to her. So please give this award to her. So now we're starting our session, Sport Medicine. Zurab, the floor is yours. Dear colleagues, thank you for coming. my report, as well as all other reports, it's related to athletes. So talking about an athlete, we see a person of totally different physiology, so the risk of negative complications and consequences should be different, and it is different and will be different from general population. In my report, I'd like to briefly show scientific and practical activity of our center within last 10 years. During these years, we performed over 2 million deep and profound medical studies. If we take each study, it's about 15 million studies, and if we add some exams, some neuro specialists exam and sport doctors that first meet this athlete and then do the follow-up, then this 15 million we can multiply by several times. So shows to 1,000 contests, so 2 World Cup on hockey, on athletics, on rugby, Olympic Games. We brought 720 people there. So we work with the whole world there. In 2018, there is not Irena, who was the chief doctor at the Football World Cup in Moscow. So many people, and we also deal not only with athletes but also with fans. So Moscow Scientific and Practical Center presents this sports center of Moscow. We have 7 outlets. So it's a rehabilitation and sport medicine. And Igor Yusuf will tell you in more detail about our sport doctors. We also have 400 organizations with sport medicine in Moscow, certified, but not all worked in the same direction. And of course, bones and muscles are the most important for any sport. So for muscles, it's to create fast and slow muscle fibers, depending on the sport. So slow fibers imported for all kind of stamina, all the cyclical types of sport. So fast, it's for bodybuilding, athletes, and when speed and strength is important. And so risks can lead to fatigue of muscle spasms, cramps, and muscle damage. So we performed the scientific research in terms of muscle cramps based on Football World Cup, Athletic World Cup in Moscow in 2013. So when we checked almost 300 athletes, we see only 3 cases of muscle damage. If we don't know this fact, it leads to overtreatment. So extreme load can related to muscle work can imitate some serious pathology. And so athletes with serious changes show better adaptation to serious load of training. So we reported all this in Lisbon at the Congress. So it's very important to form the proper type of muscle fibers under the specific exercises. It's not always clear if we can't use invasive methods. Together with mathematicians, we developed an optimal system of load test to detect aerobic and anaerobic reserves, to prevent all the negative activity of muscle work. We also showed that anaerobic system, stops at 16-17, that's stamina. As for the indicators of the maximum work, is performed during adult age, and it's related to the anaerobic power, responsible for strength and power. So it's important to raise awareness among trainers as for the scope of exercises. One of the main consequences of the muscle overexercise is muscle trauma. For instance, in the Olympic Games in Sochi, we saw that instrumental diagnostics was not fully worked out. So they use MRI 24 hours per day. It's very expensive, but ultrasound of those muscles or trauma of joints wasn't used enough. And little by little we started using it more and more and taught everyone who didn't know how to do it to use this area. For quick recovery, it's important to provide help and care and treat the trauma. So the clinical medicine treats different tasks. So you know what neutropenia is. So it's doctor's mistakes, not on purpose. So there are risks how to provide help when there are sport trauma. So we created our own concept, taking into account some additional factors. You can see them at the screen. So we added the use of gels, enzymes, almost for all the traumas we use Flogenzyme, from 60 to 100 pills per course, constant monitoring, and taping. We think it's very important. So sport activity can lead to traumas. That's not very often among common population. In game sports, it's ARS syndrome. Adductor rectus symphysis participate in this syndrome. Stress fractures, like this fifth metatarsal bone. So in the common medical care, we just put the cast and repeat it after 5 months. We should operate on it. Another interesting case, we described a bilateral hamstring rupture. So you see, it's semi-tendon muscle. So Paget-Schroeder syndrome for goalkeeper. So this area, it's very extreme hand position, arm positions, very rare, but rarely, but it happens. So we reported about it at the Global Congress of Football Medicine in Barcelona in 2017. It's very important to improve all the methods that we already have, how to help athletes. For instance, when we just put apply cold. So we tried this method. Hyperbaric gas cryotherapy also helped us. We scientifically proved the use of enzymes. So enzymes help faster recovery, 1.5, 2 times faster. Another important thing is neural system to coordinate all this muscle activity. So for runners, long distance runners, we saw that they lose up to 4% body weight because of liquid loss, lower body temperature, So some unjustified intravenous infusions without indicators can lead to serious complications and draw the attention of anti-doping committee. Endocrine system is also very important. It regulates when there are overtraining, over-exercising. It can change hormone level like testosterone and cortisol. So they will activate catabolism without clinical symptoms. So most efficient drugs that are prohibited by doping, they are all hormonal and some humoral factors of metabolism. So when the use of doping can lead to some instability in the body, especially for kids and teenagers. And the role of sport doctor is very important, and we also apply a lot of effort here. We developed some manuals and guidelines. So you may see it. This doping and questions and answers. A lot of sports requires aerobic readiness, so cardiovascular system should be experiences a lot of overload. So the heart is transformed into an athlete heart. So you see, we can see it. So stress changes related to overload of the cardiovascular system we meet at 15% of all the athletes. So it's a hypertonic reaction to stress. Not all the changes may be prevented because there is not enough coverage. So we had a very tragic example. So Konstantin Yeremenko, great football player who plays mini football and died right on the field. So there are cases where sport activity is counterindicated and just 0.1%. So today it's considered that one of the main causes of the instant death is commotio cordis, when there is some blunt kick into the heart area. So in most cases it's a younger athlete who is suffering, and one of the preventive measures is to prohibit official and unofficial young athletes with senior groups. So athlete heart, and it's sometimes it's almost like pathological heart, cardiomyopathy. So it requires new approaches, and so we have some new tests to assess the heart reaction to some specific stress that allowed us to bring global, so international athletes to success. So this is beach volleyball. This athlete was not allowed to practice, but then we worked with him, and after that he got even 2 more gold medals. We should say that usually athletes keep quite high tolerance even in older age, so when they're already veterans. And so this test should be different than in traditional medicine. One of the most important things is how physical exercises influences the immune system. Another thing is sport pharmacological correction. It's not exactly our area of interest right now. Now we only work with some profound medical studies. Another very important thing is to create a specific lifestyle, so personification of diet. Special attention should be paid to microelements, microelement status. So we can compare the work of the body with any equipment like a car. So as Dr. Kinderman said, so FIFA representative, a football player during his career ran about 300,000 kilometers.
So that's why we compare sportsmen with cars. Probably Zhiguli could never make it up to 300,000 kilometers. So here you can see prevention and different measures of prevention. And muscles and skeletal system is the main thing for the body, just like engine and the car. Now, as to cardiovascular system, heart pumps blood, and in the car it's the fuel system. Then regulatory system that includes nervous system, endocrine system, and immune system. It's like a gearbox in the car, and only optimal interaction between these three components can help you reach success. If something breaks down, like the engine or trauma, over-exertion, or a sudden death, this has to be monitored by your doctor. So these are the main goals for us when we conduct our studies, and we have contributed in this research. Thank you, colleagues. Maybe I was telling you too fast, but anyway, thank you for your attention. I was playing for Barcelona for some time, but it wasn't for long, only 3 years, but they paid me very good money. Thank you. And now I would like to give the floor to Igor, who is the head of Department for Sports Medicine. So he's going to tell us about sports medicine in Moscow. Maybe he'll be using a drier language than me. Thank you, Zurab. Good afternoon, colleagues. I'm going to describe the system of medical care, focusing on sports medical care. So, sports medical care has been confirmed by the President and the government of the Russian Federation. The most important thing is to develop healthy new generation which should share the values of active lifestyle and physical culture. And we should make sure that we have best people for the sports of high achievement. So that's why the Council, by the President and the Ministry of Health Care, states the importance of providing medical help. And according to the instruction, the Council under the President for Development of Physical Culture and Sport, the priority has been put on the development of sports medical care. That's why there'll be 2 medical centers built in the regions and 1 center built in Moscow. So what does sports medical care looks like? So this is the image that shows you what happened over 70 years, and you can see the changes in different in the structure and the different branches that provided sports medical care. So we have 7 branches and 66 sports doctors. And if we compare it with 1949, we had 36 for 3.5 million people, whereas now we have only 7 branches, whereas the size of population has grown. But this graph shows you the number of Moscow residents that do physical exercises regularly. So you can see that the number of people that want to have active life and do some sport is growing. So what kind of structure do we have? Speaking about Moscow residents, so we have 4.5 million of people that do some sports, and we have 0.5 million of sportsmen, and 129,000 of these sportsmen are monitored by our branch, and they are all ready to do some tests, and the numbers of people that pass the tests grows every year. This slide shows you the Moscow residents that do sports. Schools and universities have 1,600,000 people doing sport, 1.6 million do some sports at private federations or clubs, people with disabilities, etc. Over 5 years, the trends have changed. It shows that there are less athletes that go to young people's sports schools. It means that children lose interest in doing sports, no matter how much we try to promote it. That's a fact. Our branches provide medical support for Moscow residents. So we have 129,850 Moscow sportsmen that go through our center. So you can see that the numbers that show you people that go through examination at our branch. And medical support for sportsmen is closely related to training process and is one of the most important factors that can improve sports mastery and make them achieve high results in sports. So how is medical care organized in Moscow? First of all, you can see polyclinics on the first level. So there are doctors, therapists, and they work according to the decree 134. Then, if we move to the second level, you will see the branches of the center where the sports doctor provides medical help, and these doctors have a quite narrow specialization, so they provide professional care. And finally, the third level for sportsmen that are members of our teams that play for the national team. So this is the map of Moscow, and you see the branches of our center on the left. And you can see the Red Cross, which is our branch, and then you can see the polyclinics. We gave training to 150 sports doctors we had an 18-hour cycle, and it was about medical control over people that do physical activities. We would like each polyclinic to have such specialists. The main objective for the development of medical care is to create the register of Moscow sportsmen. It's not quite clear yet where all those 4 million athletes get their certificates, because we work only with 1.5 people, and that's why it worries us. We are never sure whether where they go to buy their certificates. So sometimes they might have problems just because they were not examined on time. So this register will include sports schools, and they cannot get the certificates anywhere but us. Then educational institutions, private federations, clubs, and fitness clubs in particular. So there's a decree that will make these clubs deliver tough medical examination. And polyclinics will also be included into this register, and they will control the admission to take part in testing to see whether they meet the norms or not. This is it. Thank you very much. Thank you, Igor. And now I would like to introduce Vladimir Pavlov, who is going to give an interesting report about paradoxes of sports compensation. But before he starts his talk, I just wanted to say that he just came from a different room, and he got an award as the first functional diagnostician in Moscow. Well done. Good afternoon, colleagues. I understand that you are all interested in healthy lifestyle and sports. I guess I will make an informal presentation. It's about the abilities of people and how one thing can be compensated by another, and vice versa. One thing can suffer because of a strain. So, and I can explain it now. So those people that work with top-class sportsmen, we go to international congresses, so we get a lot of information. Our schools of cardiology began to focus more on some specific cases rather than statistics. So here you can see the program of a School of Sports Cardiology that took place in Munich. So most of the reports are dedicated to clinical cases, and I would like to give you an example of one of them. It was a very interesting case presented by Professor Alfred Hager, who is a leading specialist related to heart pathologies. At first we were confused. We couldn't understand why he began to talk about tetrado of Fallot, and he described the case, the person 20 years old, 53 kilos of weight, and this person had a heart pathology which is called Fallot's tetrad. And then this person had complications. During testing, the patient didn't demonstrate outstanding aerobic qualities. You can see the pulse and very low capacity of oxygen consumption. We couldn't understand what it had to do with sports, but then he explained that this data is relevant to the world champion in snowboard, and he has had this status several times, and it means that he could achieve excellent results due to certain factors, and this athlete continues to win gold awards. He is called Sean Roger White, and he has a nickname Red Tomato. So he could be a champion. It all depends on the kind of sport that they practice. Zurab Orjonikidze shared a case of an athlete. We observed, we have monitored him since 2014, and he wasn't a champion then. And some of his achievements were beyond normal. For example, diastolic chamber was bigger than it should be. So athlete's heart has to be diagnosed with DSM, HCM, LVNC, and ARVC, so they all overlap and they create a gray zone conception. And the same thing was to be done by us. So with empathy, the patient with this diagnosis means that the person cannot, so this cardiac myopathy has heart insufficiency, whereas this person was doing great, and our ECG test confirmed this. Here you can see the dynamics of athletes' achievements. He became the champion of Olympic Games for young people in 2014, then he became the champion of Russia in 2017, and then the diastolic size of left ventricle was bigger than it had to be. But then we realized that this was a marker of compensatory ability. So there are no clear borders for adaptive compensatory sizes of myocardium. It depends on the kind of activity and anthropometric parameters. So this person became the world champion. Another example, you can see a big man, and he is in the Guinness Book of Records. I'm not gonna tell you his name. His height is 185 centimeters and weight 193 kilograms. And he has been champion for weightlifting, heavy athletics, and he had a huge weight of his left ventricle. So in Bruce protocol, he had apnoea and he stopped on the second step. So he has almost zero anaerobic ability, less than each of us probably has. However, he demonstrated excellent qualities in his sports. So it means that the type of sportsman activity can predetermine supercompensation. And another example, you know this person very well. Actually, he gave me permission to demonstrate this. So this person has fantastic abilities. He started training for resilience. So the concentric hypertrophy turned into eccentric hypertrophy when he changed the type of activity. And you can see almost half a kilo weight of his ventricle. And you can see that he went through anaerobic test. So actually the figures of oxygen consumption are quite all right for such weight. But the person failed. And the reason was lack of technical ability. So it could be related to power or lack of technical ability. So athletes can win and become a champion due to just one factor, like power or technical ability or anaerobic load.
Thank you, Vladimir. So our next speaker is Professor of the Academy of Science, Vladimir Arkov. So new aspects of rehabilitation of athletes after knee joint traumas, injuries. So dear colleagues, I'd like to show you the biomechanical aspects that you should take into account when you work with rehabilitation after sport traumas. Here you may see quite a well-known pathobiomechanical circle. When we see some problem with patella, which leads to some external shift of patella, when there is 30-degree flexion of the knee. So patella shouldn't be in such a way, so soft tissues are damaged, and there is edema and pain, and it impacts the relaxation of the muscle. So besides, there are other factors that also impact the situation. You can look here. So any trauma, quite serious trauma of the lower extremities, lead to hypertrophy and the weakness of bigger gluteus muscles. So these muscles make these abductors, and so when they are weak, an athlete puts the knee joint in the valgus position. So she should not be in such a position, and there is dislocation at just half the story. So this gluteus maximus muscle, it's a big stabilizer of the joint. And when it's weak, there is functional instability of this iliac joint, and there is syndrome of this PIA muscle. It stabilizes the joint, but not successfully, and it puts the pressure on this gluteus maximus muscle, so the muscle doesn't properly work, and it put more and more pressure on the nerve. Besides the sciatic nerve, which works with the whole muscles of hip and the pelvic fundus. So any remedial exercises are not efficient here, because you should do exercises when stabilizes the pelvis. So the piriform muscle syndrome is much more well spread than the problems with the disc of the interspinal lumbar disc. So this situation is problematic because there are no symptoms. So in athlete, we already have quite prominent hypertrophy. So the leg may be thinner than the other, 2-3 centimeters, the hip, and even more. But an athlete doesn't feel no pain or anemia or discomfort, and that's quite typical situation that requires correction. So to correct this functional instability of the pelvis, David Leaf worked a lot with American athletes, and he suggests to stabilize pelvis, and in these conditions only to work on this gluteus maximus. So you can't sit improperly, and especially one leg on the other. Here you see how you should wear some specific belt or like a soldier belt. And to treat this gluteus maximus muscle should be as isolated as possible. We should separate this muscle to train it more efficiently. So it's the most replaceable muscle in our body. So walking training is also very important, especially first two elements. That person put feet close together, like walking through one line, and make very wide steps. But after injuries of knee joint, for athletes, they showed that this dysfunction has some limits and some clinical characteristics. So it's important that an athlete after injury was always without pain, without discomfort. So possible biomechanical factors that leads to persistence of this pain in knee joint. So any edema in the knee joint, including quadriceps muscles. So even if there is contraction in the joint, that they'll lead to pain. So we should restore the movement. If there was no body load, so the pain for 4 weeks, pain will increase 4 times. So pain as like biomechanical factor, it slows down the activity and functions of muscles, changes the structure of muscle activation and strategy of movement management, and the models of movement violation does not stop. So to treat pain, we can use cold at the fat compartment at the end of the knee joint, knee cup. So the tasks of remedial exercises to control edema and pain, to develop full range of movement, to modify active exercises, to activate the key muscles, and to correct the walking. You can also use all interesting physiotherapy, like you can see here, to reduce edema and pain, and anti-inflammatory, if it has an anti-inflammatory effect. There are some common procedures that modulate immune response and magnet stimulation. Kinesiotaping, it's a very interesting technique. So effect is very good with edema and inflammation, but it can't stabilize the joint mechanically, and we need to use some other options. So the range of movement, very easy exercises that allows to restore the range of movement in the knee joint. Remember one main thing, they should be many times per day. So if you restore the volume, the range of movement, it doesn't matter, it will stay. So half a day and patient can't walk the leg properly. So it's important that he works like every hour. To mobilize soft tissues and patella. So the fat pad allows the mobilization. So when we talk about some safe angles of range of movements, so squats are safe. So key muscles here are gluteus maximus, medial, gluteus medial, abducting muscles. So to work with tunnel compression neuropathy and all the three nerves that innervate the whole leg under this compression neuropathy after the injury we talked about the piriform muscle syndrome. There is also problem with femoral nerve. So why do we have issues with this muscle and this femoral nerve? Because there is direct muscles and this muscle, and they put the leg ahead. So quadriceps doesn't work, and this muscle starts to compensate. It increases its volume, and here you see a typical place where this muscle is compressed. So I think we should exclude specific exercises because they damages the nerve. So instead we should increase the range of motion and working on the oblique ab muscle. So this exercise on the left should be prohibited up to some point in the rehabilitation. On the right you can see the person who suffered from such exercise. So it was supposed just one per day, but they made her raise the leg when she was laid on her back once per day, and as a result it was a contraction. Now the person sort of disabled and no quadriceps. Of course we rehabilitated this person. The main thing is that we work on the range of motion the whole day quite often. Here we see the main thing is to work with oblique muscles, stabilize patella, to make the direct femoral muscles. Here you see dynamic valgus and the correct on the right. So dynamic valgus is when the knee is inserted, twisted inside, when an athlete steps down. So balance training is made on some unstable supports, but always when we exercise on unstable supports, we need the correct stereotype of putting an athlete to the platform. Then the training will be very good. Suspense system are very good, but we need a good specialized person for them. And of course, don't forget to use some specific combined peripheral drugs to support the cartilage structure. Here you can see the collagen synthesis in ligaments. Quite often we have to restore ligaments and synthesis of collagen and ligaments. We can use it with intervals. I recommend 2 weeks of consumption, 1 week break. If there is pain syndrome, you can use some ibuprofen and then some chondroprotectors. Thank you very much for your attention. Thank you, Vladimir. Your name always reminds us of our president. The next report will come from our employees. Well, Natalia Leonova, the results of clinical observation of correction of younger athletes with overtraining of the heart. I'm a practicing cardiologist, and I will talk about the adaptation of the cardiovascular system to exercises of younger athletes. So the average age is 11.8 years old. So during exercises there is adaptation of cardiovascular system to physical stress, to achieve more efficient work under stress. And both morphology and function of the heart are changing. and it's called a sport heart. But it's not diagnosis, it's just definition. And now they mostly show not the adaptation but disadaptation that can be as a result of over-exercising or over-fatigue. So when there is inadequate physical exercise, and especially it happens with younger athletes, there is some decrease of physical activity, and it can be restored from a couple of days up to a couple of weeks. Before overtraining at some pathological state, it's a disadaptation. There is a problem with regulation of organs and systems, and the disbalance of the ratio of the cortex with other organs, and the recovery may take from a couple of weeks to a couple of months. The reasons are well known: inadequate mode of training, chronic infections, doping, some autonomous nervous system dystonic. So it's well known that 20% of athletes of high qualification during their career experience this over-exercising state. 70% of elite athletes that train stamina. So when there is this over-exercising syndrome, there is no common understanding of physiology before the symptoms appear. What are the negative changes and consequences? So there is change of psychological status, hormonal status, change of biochemical indicators of blood. There are two clinical symptoms, so sympathetic and parasympathetic form. So according to clinical factors, similar to these diseases. So over-exercising, it develops in cardiovascular system, nervous system, immune system, locomotor system, and hepatobiliary system. So what happens with cardiovascular system? So we see the problem with repolarization processes, heart rate rhythms and conductivity, arterial hypertension. Methods of studies, of course, it's some exercise test to check the variability of heart rate. So to help an athlete recover, we have to correct the exercises. So during a couple of weeks, some hygienical methods, medico-biological, physical therapy, and pharmacological help. At the beginning, I said that the average age of an athlete is 11.8 years old. So we work with minors and as well as adults. Younger athletes have adaptation to their training. So the heart volume increases, but there shouldn't be any dilatation. So there shouldn't be any rhythm changes and high stamina. And so when there is over-exercise, it's very hard to diagnose because there are no common criteria to interpret the changes from the point of view of cardiovascular system and other systems for younger athletes who experience huge physical exercises for at least 3 years. There are also difficulties in diagnosis from the point of view of overtraining or for exercise, or some other diseases that have similar clinical signs, especially at the beginning. So we use age indicators of normal ECG for children and teenagers for Holter monitoring, how to interpret ECG changes of the cardiovascular system, and the heart size is defined taking into account the whole body area through percentile corridors. So according to the different age and area, so heart structures may be different. We also take into account all well-known schemes of remodeling of the left ventricles when we assess the change of cardiovascular system. So what have we found in the clinical study? Dysfunction of the sinus node. So sinus bradycardia is less than 5 percentile. According to ECG interest and while exercises can be at 15–30%, mostly when doing swimming, hockey, football and basketball, and for girls at gymnastics and swimming. So repolarization process violation, mostly for boys playing football. Ventricle extrasystole is the same for all sports. So what are the methods to correct the training process that we apply? To reduce the amount of training by 30–50%, complete absence of training, reduction of the length of training and volume of exercise, and not presence at contest, and we monitor them from 1 to 6 months. So some minor changes get stable after 1 month. So if there is double secondary lengthening of QT interval, it gets back to norm in 30% of cases after 2–3 months. But we should understand that it may be a genetic syndrome.
Here you can see a case of our football player. He came with complaints that he feels tired, and you can see that there were quite many disorders, but after several days of detraining, ECG was normalized, and the minimum rate was 24 beats per minute, the pause was 2,484 milliseconds, so this person did some training, but it was reduced by 50%, and we could see improvement with a rate up to 40 beats per minute, which is a norm. Here you can see the example of a young swimmer with eccentric hypertrophy of left ventricle. You can see that the size of the left ventricle was bigger than should be, so he had already very good sports achievements, and he had hypokinesis of the left ventricle wall. As a result of our treatment, his state became normal. So we monitored him for several years and made adjustments to his workload. At the age of 17, when he was preparing for the next sports category, you can see some indicators that he had, so we can see progressive eccentric hypertrophy of left ventricle. So we reduced the load of training and reduced number of trainings up to 7 or 8 per week instead of 10 or 12, and in 3 months, his state became normal. He didn't have enough training, and so he lost the good sports form, and he decided to finish his sports career. Now conclusions. When we make adjustments to the training process, we observed positive dynamics in the indicators that the young sportsman had, with some deviations with electrocardiogram that was seen in the heart rate and the repolarization process. So it's very important to make adjustments to their exercise load and training load, and we understand that we are responsible for these athletes from childhood up to the adulthood. Thank you. Next speaker is a very interesting specialist, head of biological department and head of sports school Sambo 70, Vasily Vybernov. Hello, thank you for this opportunity to speak. I would like to make a presentation about new approaches to sportsman nutrition. Food and nutrition is a very important aspect of our activity. Our look, our abilities depend on nutrition. And there are 2 points of view. Some specialists think that food and diet is a very important component of training process, and other specialists have a different point of view, expressed by an Italian football coach who said that a plate with spaghetti could never teach my sportsman to win. I have worked at a big organization with 17,000 athletes, so I had a chance to conduct a survey to see what our trainers think, and basically I included just 2 questions in my survey. Is food and diet important for athletes? And all the respondents said that yes, it's very important for athletes. And the second question was, what is sports nutrition or sports diet? So somebody said they have to eat less fatty food. Some people said they should get some pills. So the level of knowledge was very low among our trainers. And the main principles for the development of athletes' nutrition are evidence-based, individual nutrition system depending on the kind of sports and energy exchange, taking into account training plan. So it's very important to develop microcycles and mesocycles of training, and finally feedback and monitoring of clinical and functional indicators for nutrition adjustment. So this also means that we have to understand what kind of system can we use and who should implement it. So here you can see several components of this system. All these components, or steps, so to say, are equally important. It all starts with motivation, so no matter what kind of means and tools you can give to the sportsman, like means of adjustments and other things, he has to understand that it's very important. Otherwise, you will never have a success. Next step is special data about his nutrient state, his energy consumption, and other individuals' characteristics. Then analysis of training plan. I already said that it serves to analyze micro and mesocycles, so it's quite detailed. Setting goals and implementation plan. And I have to say that all the questions related to nutrition sound like the questions from template. So we sometimes lack understanding of some specific goals that athletes have to reach. And finally, performance evaluation. The better we do it, the better we understand what to do. So there are some regulatory documents and norms that can help us to organize food and provide nutrition. So there's federal law on physical culture and sports in Russian Federation. There are norms of physiological needs and sanitary norms. There are also methodological guidelines. Some of them are new, some of them are old, and these guidelines or recommendations are for information only, because they won't help you to introduce a single system. And once we organize the system, we have to understand who should do and who should work within the system to train sportsmen. So the first person that we can think about is a doctor and a dietologist, but dietologists usually work with sick people, and their experience can be useless for athletes. The second specialist is a food technologist. I don't want to stop here because he deals only with quality of products and he has nothing to do with sport. And finally, nutritionist. And actually, this specialist cannot be found in our classifier of different jobs and professions. That's why he doesn't have a status. So there is no protocol of interaction of nutritionists with trainers and other specialists. There is no standardized system of control and education. And that's why we can see very low quality of services from such specialists. And anyway, the status is not quite clear. And here I would like to share some of our results. We were working together with the Federal Center for Biotechnologies and Nutrition, so we tried to develop a joint protocol of the trainer and nutritionist. So it was tested and it was quite successful. The most important thing is that the nutritionist and coach should work together at certain points. And there are several steps that we can identify in this process. At first, the trainer has to identify the basic physical qualities, and the nutritionist will assess their own components. Then the next step set some specific tasks and goals, and the final stage is to make conclusions to see whether the trainer and the nutritionist reached the desired results. Thank you for your attention. Thank you. Next presentation should have been delivered by a different speaker, but Vladimir Pavlov will make the presentation instead of Victoria, who is in Qatar at the moment. Dear colleagues, friends, even though we don't have the speaker who prepared this presentation, we will have this presentation. I understand that we don't have much time, so that's why I'll focus only on main aspects. So it's about diagnostics, and as you can see here on the slide, this is what the specific tests might look like for athletes that do skiing. And in fact, this photo has been very popular on Facebook, and there's even a group that uses this photo, even though they do not refer to our center, because it was our photo. There are certain regulations, and instruction 134 in particular, and they give classification with a pragmatic purpose to identify the scope of examination for different groups of athletes. First of all, it's the first stage is there is no stress test. Then the second stage is initial training, and at this stage they have many different tests, and they check sexual diseases, blood biochemistry, some functional tests. So they care about venereal diseases and many other things. Now, what does it look like at our institution? Briefly speaking, we try to have 11,000 tests using the same algorithm. First of all, the sports doctor takes part in this. Then we make the primary assessment, and then we have stress test. So we also make research in the rest state before it, and as a result of stress test we can go for some additional research like ECG monitoring on daily basis, and then we move to highly technological examinations, CT and many other things. This is the statistics, and it's quite specific for sports. It has a cyclical character. The biggest workload is in the spring and autumn, and the minimum workload is given to athletes in summer. So what's marked in red, it means that these patients need additional examination, so sometimes there's not enough time, we don't have enough time for tests. That's why we have to find time and do it again. Now, echocardiography, it can identify hypertrophy of the ventricle, dilation of ascending aorta, aortal valve, and there are certain algorithms for us to prove whether it's a prolapse or not, because it could be a true prolapse and false prolapse, so it needs a confirmation. Ultrasound of abdominal cavity, we can identify splenomegaly, some changes in spleen, hemangioma of liver. The same is true about thyroid. So we have quite many researchers that deal with this thyroid gland, and they say that some changes related to thyroid can be more often than in general population. So this is a clinical example when the false tumor was identified. Another aspect that is worth mentioning is related to meta-examination. We have our own specific features of physiology that goes beyond average state, and the characteristics can be very different.
So the third and fourth tones are not indicators for heart insufficiency. Because that may be the result of straining process. So arterial pressure is much lower for athletes. It can also provoke some suspicions at doctors. And the pattern of ECG is also different. But as for arterial pressure, blood pressure, hypertrophy and bradycardia, these are the most typical things. So hypotonia and hypertension can reach quite extreme figures. And now we can see that now it's quite rarely that hypertensive, mostly it's a hypertension than hypotension, which I think leads not enough recovery period and a lot of requirements to intensity of training. For instance, we are checking it on hockey teams. Almost no hypotension, but hypotension. We should also pay attention to exercises may be different, and the cardiovascular system may react differently. So to dynamic and static training. When we measure blood pressure, when you don't know how to do it, may lead to wrong interpretation. Not everyone knows that under stress, so at under exercise, so there may be some changes, and so you should really read the recommendations of hypertension, because while exercising, we can see that there is this phenomenon of limitless tone, but there is at the same time this slowing down of the tone. Because if we speak, so diastolic pressure can't be zero. So ECG pattern is different. And so international guidelines that are always changing. There is normal, borderless, and abnormal. So So quite often clinicians make mistakes while registering, so making ECG in automatic mode. So this points are this, can overlap. So what are the mistakes? I'm sorry, I'm almost done. ECG of negroid people is different. So in interesting case when a pathology like earlier repolarization is considered like myocard heart attack. So when it's recommended that the person does not participate and the person continue to win. So mistakes in ECG patterns. That's recent picture just yesterday. So required diagnosis. Either we diagnose that we can allow a person to contest or not. And the price for the mistake is great because either person loses a job or the athlete can have some very negative consequences. So it's very, very hard not to make a mistake. So we use additional studies. So I will not tell you more. So overall it's clear, all the difficulties. Thank you very much for your attention. Thank you. And now if you're... So now Tatiana Pushkina representing FMBA. So we have a bit of time. So Federal Medical Biological Agents. So my report is quite overlapping on with previous speakers, so I'd like to highlight some moments. So when a child is brought to sport, a family has lots of influence. A family motivates the kid, so trainer motivates the kid. Kid is motivated him or herself, and so the doctor should also get some influence on the kid, that the kid will not be afraid of the doctor, that the doctor will be the person who stops its motivation. So there are some complex checkups, and so to assess all this readiness for contest. So it's always doctor's assessment. So today we talked a lot about Law 134 that will be changed soon. And here we'll ask the question, are we diminishing these requirements to the medical exams? And what are the risks if these requirements will be reduced at some stages? So to make them more easier to organize. Our country is really big, so not everywhere it can be possible to be performed in quality. So these are the names of athletes that in different sports died in 2019. So as a result of all this medical checkup is the doctor either allows the athlete to go to participate in contest or not, and that's huge responsibility. And I hear from colleagues what kind of responsibility is on doctors' shoulders. Another case that we had, so a syndrome of non-compact myocarditis. Before no indicators, but during first medical checkup, ECG showed some increased cardiovascularity of left ventricle. So some changes in endocarditis and ratio 2:1 of compact to non-compact. So made some research, brought some specialists. So an athlete was allowed, but one condition was to bring for complete checkup once per year. Another athlete, so for the first time he came to us. We recommended to make Holter monitoring, stress echo. So an athlete made the procedures but then returned to the region. I don't know how to turn on the video. And so he was not completely monitored and surveyed, and as a result an athlete died during training. Another interesting case, syndrome, non-differentiated dysplasia of connective tissue, hockey, a plaque was in the left hand, some anemia, partial loss of vision, lots of studies. Here we can see the final diagnosis is vascular anomaly of carotid, of the carotid artery, both left and right, vision impairment, and so an athlete is not allowed to train. Another case in hockey, we talked a lot about elongated interval of QT, the second molecular genetic option. So an athlete was not allowed first in 16, but continued his training at the club. Then got to us, and we made this genetic test. Saw this gene mutation at the same time, so an athlete continued to hide it from the medical history. So the father died in sleep at 40 years, grandfather the same, though an uncle brought the kid at 6 years in sport, and in teen years with very high pressure. They tell us that they should take him to the team. And so the athlete was not allowed. It's about this family pressure and hiding of some facts. And a very interesting case, 16 years old, an athlete was already in the team, echinococcosis of the liver and lungs. Since 2016 to 2019, 5 athletes with HIV. So main issues during medical checkups of athletes who for the first time joined the team. Some pathologies are absolute contraindications for training. Nevertheless, they come to the top of sport. Maybe it's not sufficient medical checkups before, maybe some secrecy. So absence in the regions of this physical therapy institutions in regions that can provide proper medical checkup. So we have many reasons for that. So it's not primary help that now will be modernized and actively funded. And so they are funded depending on the interest of the region in this specific facility. So as a result, we have the lack of funding and the lack of medical documents from the previous medical organization to really make the to monitor this. So thank you for your attention. Health to all of us and our athletes. So a doctor should not be under pressure externally and should make a decision based on facts and based on data of the professional community. Thank you very much. Dear colleagues, I'd like to note once again to congratulate everyone who came here to listen to us. We didn't manage to discuss anything, but I hope in corridors after we are leaving we can discuss something. And I'd like to ask Moscow Scientific Practical Center, who's represented here, but most of us to take a picture, that we make a common picture, remember this, the beginning of 2020. To remember it later on, maybe it'll be in social media. If you don't mind, please, let's take this picture. And before leaving, I'd like to tell you a short story. So you saw a picture with me with our football players from Barcelona. So small donkey and small horse, they were friends in a village, they were playing, and then a horse was noticed and was taken in some city. Then British Queen bought it, and so this horse earned a lot of medals and prizes, awards, cups, and once it called its friend and tells this donkey, "Dear donkey, come to here, look at me." And donkey came looking at all these prizes, awards, and decided, how can I respond? So, "Dear, please bring zebra photo and my photo." So he put his head on the zebra body. So horse came and he asked, "What is it?" "Please don't pay attention to it. For several years I played at Juventus." So let's make a picture.
Реабилитация, восстановительная спортивная